Hello, everybody. Welcome. We'll give folks a minute to get into the space.
Good afternoon.
Good afternoon. Giving folks a couple minutes to pop in. It does not look like we are close to quorum yet.
Is that Lloyd joining us? I'm so excited.
Hey, everybody.
Hello.
Good afternoon.
How's it going?
Going well. Hope it's the same for you.
Yes. Thank goodness.
Welcome, everybody. We're giving folks a few minutes to enter the space. I have not received a message yet that we've reached quorum, so I believe that we are still waiting on that. Thanks for the message, Lloyd. We're glad you're here.
There's two more for quorum.
You said we need two more?
Two more for needed for quorum.
Okay. And quorum is different today, correct? Because we're a full COC meeting?
I'm not 100% sure. That may be a Colin question. This is like my first full COC HSAC meeting. He just came into the room, so he may
Okay.
be able to answer.
Sure.
What's the question, Eliza?
Yes, thanks, Sally, for also in the chat. The question was, is our quorum different today? We're counting HSAC and COC members because it's a full COC meeting.
Yeah, I mean, we'd have to have a quorum of the COC and a quorum of the HSAC. And all HSAC members are considered part of the COC, so.
Right. So I was just curious if that helped us
Mhm.
reach our quorum today, since I've seen
Yeah,
a couple folks.
it would help, but you also have to remember that, like, I see, looking around, there might be multiple people on from the same organization, so there might be 2 or
Okay.
3 people from Urban Ministries, or 2 or 3 people from FMF, or 2 or 3 people. So as an organization, you have 1 membership, 1 vote.
Sure. Okay, so I'll just wait to hear from you all when we have quorum. I think in the meantime, the other question that would be helpful to clarify before we get started is, and I can do this as we go through each item, but there is a couple voting items. Is there a voting item in particular or multiple that the COC members, representatives can vote on today?
Yes, ma'am. There are 2 items that the full COC gets to vote on as COC members. Those items are the COC NOFO priorities for funding and the state ESG prioritization for funding. Those who are planning to or have grants already with those will need to recuse themselves from that vote. So if they're
Okay.
planning to apply for state ESG or planning to apply for HUD COC funds,
Okay.
folks, organizations would need to recuse from that.
Okay,
The
and
second
that-
item that the full COC will be able to vote on is more of a formality, but it's something that we need to look at doing because we haven't done it in a while, and that's designating our HMIS lead agency and the COC applicant, consolidated applicant who's going to submit that. And we also, just as an ounce of prevention, establish how we will approve our HUD COC NOFO application in the event that that application is due and it doesn't line up with a normal HSAC meeting for approval. So we'll need to talk through what would be the contingency would the COC as a whole allow, and we'll talk more about it later.
Okay, can you help just identify for me which agenda items? I think the first one fell under full COC approval for compliance.
Yep.
And the
That's
second
the-
one
Mhm.
falls under the same or another one?
Hold on, let me pull up, I don't have the agenda in front of me.
Okay, sure. And then I think while we're doing that, I still have not gotten a message about quorum. So hopefully we'll get there soon.
I'm trying to determine, Colin, maybe he can help me.
Give me a
How do I
second.
determine quorum for the COC members? They're not
Give me a s-
identified here.
You
Give
can
me a
just
second.
add the number of HSAC members to the number of other representatives on the COC form that you and Anthony worked on. So just look at that membership list and then add that to the number of HSAC, and then it just needs to be one more than half of the membership. So if it's 50 total, then you need 26 for quorum.
So yes, Eliza, it would fall under full COC approval needed for the compliance items, COC, CFR. So that's the COC, NOFO, state ESG, and the
Okay.
Yep.
So
that's
it's all under that item. Okay,
it's
that's
all under
helpful.
that item. Mhm.
Okay. Okay,
Have
great. So
two
when we get
separate
there-
two separate slideshows for it though, just to keep it a little bit cleaner, and then they can be consolidated into one if you prefer.
Sure. Okay, well, we're gonna go ahead and call this meeting to order. We will skip minutes as we need to. So I'm calling the June 26th full continuum of care meeting to order. It is 3:09. Just some housekeeping. Check the chat to fill out the sign-in form. So hopefully that will be in the chat soon. We need you to sign in for the meeting. Some reminders, stay muted unless you're coming off mute to speak. If you've got questions, raise your virtual hand. if you've got a question that you'd like to ask out loud, as we have time throughout the meeting, we'll get to those. And then we'll also monitor the questions in the chat. And thanks to Colin and his team for supporting us in that. Great. So any public comment today? I did not hear of anything before the meeting.
There's no public comment that I've seen.
Okay.
Registration.
Anyone here that would like to give public comment? Seeing a couple hands raised. So we've got 2 folks and we've got 5 minutes. So if y'all could do 2 minutes each, that would be great. I'll start with Sally. I see your hand first.
Thanks. And I did submit the request for public comment yesterday before 5. So I guess we'll need to follow up to see what happened to that request. As noted earlier, there is on the agenda a vote today about prioritizing some COC funds and state ESG funds. And I would like to request that when we have important votes coming before HSAC, that materials are sent at least a week in advance of the meeting that provide any recommendations that are going to be coming to HSAC and that include any data and supporting rationale for those recommendations so that members can think about those votes in advance of the meeting and collect any additional information they would like themselves in order to make an informed vote. Thank you.
Thanks, Sally, for bringing that forward. Jeremy, I see your hand.
Hi, my name is Jeremy Bergeron, and I didn't sign up for one. I'm not totally sure how to sign up for a public comment, but I've joined the past few meetings, and I want to say I appreciate everyone's work. I'm a formerly homeless person. I'm a veteran, and I receive help through the VA, even though I don't get health care through the VA. And my comment is not to be rude or anything, but my comment to other people I know in the community was, it only took me being on one of these meetings to realize how I became invisible as a homeless person in Durham. Some of this had to do with the point in time count and the numbers. And then as I learned about some of the processes that go behind it. And so as a formerly homeless person, I still am interacting with a lot of homeless people or formerly homeless people. And I've gotten head nods from basically everybody. And I'm not trying to represent anybody. What to say if the same type of approaches go into these point in time counts or the business operations, and there's going to be a whole lot of homeless people that are basically ignored or falling through the cracks. I know that there's some money coming in because I saw a city council meeting the other week about it. And so then I had concern about that specific demographic, about what that really means, just because we're putting money towards an issue or for a demographic. It was hell going through a veterans program. I really literally had to do a sit-in in the VA just to be seen and enrolled in the program. And if I hadn't received advice from older veterans about that specific process, I never would have received intervention help. So I just want to say I appreciate all the work you're doing, but whatever the process is for counting and for seeing homeless people, I just noticed that there's a invisibilizing that goes on. And I don't know what can be done about that process. I certainly don't feel like it's a few questions that can be answered to fix it, because it's so big. But I appreciate y'all hearing that, and I appreciate even being able to come on these meetings as a resident and someone who's formerly homeless. So thank you for hearing me.
Thank you, Jeremy, so much for bringing that forward and for being here. All right.
Eliza, I'm sorry, if it's appropriate, Jeremy, if you like, I work with a lived experience work group that is getting ready to expand to members of the community in a couple of months. So if you would like, if you could send me a private message in the chat with your number, I'd be happy to reach out to you if you'd be willing to lend your voice to that conversation.
Thanks,
Thank
Anthony.
you. Sorry, Elijah.
No problem. Thank you for lifting that up. Are we still waiting for quorum?
Eliza, I think
We're,
Melissa.
we're at quorum. I just
Okay,
counted. We're at
yeah.
quorum.
Great, wonderful. Thank you. All right, we'll move to the next item, which is the approval of minutes. We are approving our May minutes. So hopefully y'all had a chance to review those. If not, take a few minutes now. Any edits or corrections to bring forward? All right, I'll open the floor for a motion to approve the minutes for our May 2024 HSAC meeting.
This is Angela Holmes. I approve the minutes.
Thank you, Angela. Do I have a second?
Renee Vaughn, second.
Thank you, Renee. And as a reminder, this is a vote for HSAC members only. So please vote in the chat, yes, no, or abstain. All right, thank you. Our minutes have been approved. All right, moving on in our agenda, our next item is the collaborative application for ESG and COC update. Anthony will be providing this update for us, and this is information only.
Sorry about that. We got to me quicker than I thought. Can you all see the presentation? A thumbs up if so. Okay,
Yes.
perfect. Thank you, Elijah. Out of the gate, I want to apologize to those of you that may have seen a version of this presentation before. We do present versions of it through committees, and then sometimes that information is repeated when the full HSAC is together. So bear with me. I will go through a few things today. I want to cover some high-level information regarding some recent evaluations that we did, and then provide an update on where we are with our funding competitions for the current year, and that will involve information around the North Carolina ESG competition, which we're currently in, as well as the what we know to date about the Continuum of Care application. So, I want to talk a little bit about some evaluations that we completed. They were Housing First evaluations as well as COC performance. I hope you all can see this. There's a lot of text here. I tried to make it so that it would be kind of easy to understand because it's a lot of information. So I'm going to focus on the Housing First evaluation first, and then we'll talk about the COC performance evaluations. So with regard to Housing First, this is an evaluation that looks at how organizations implement the Housing First approach within all of the projects. We do this annually, and we focus on permanent supportive housing and rapid rehousing projects. The components of the evaluation involve housing process and structure, housing and services, service philosophy, service array, meaning the breadth of services that are available, and then the team structure and HR. The reviewers typically are members of our HSAC, our COC membership, and our lead agency staff. And the approach we take to this evaluation is to look at the evaluation tool once a year, to provide training to the reviewers, and to hold feedback sessions with the reviewers and project staff after the process is complete. And the materials that we use in the evaluation are the policies and procedures of the projects that we are evaluating. We interview project staff, and in some cases, people with lived experience who are participating in projects. And we also look at performance reports from within HMIS. So regarding the COC performance, this one evaluates and helps us to rank projects for the COC competition. We do it twice a year. We look at it in the spring and in the fall. In the spring is more informational to help the organizations know where they're falling, so that if they want to do some tweaks and make changes to service delivery or performance enhancements, they can. And then when we look at it in the fall, that is the one that we use to rank the projects for funding in the annual competition. Again, we look at permanent supportive housing and rapid rehousing. Those components are performance measures, the high need populations, efficiency and operation, use of HMIS, and equity. And the reviewers for this one typically lead agency staff. This year, we worked with the HMIS lead agency because you've heard us say we automated the tool that helped to streamline and reduce manual human error in the performance evaluation. We piloted the tool, it saved a lot of time. And after we were done, we held feedback sessions with the projects. We'll talk a little bit more about this in the results. And all of the information, or the vast majority of the information that's used in that evaluation comes from HMIS. So that was the context for each of the evaluations. Are there any questions on that? Because the next slide is going to talk a little bit about the high-level results. And Keisha, I'll rely on you. I can only see a few people. I can't see everybody. So if there are questions, please, you guys stop me and ask your questions. So let's talk results. For Housing First, we looked at 9 programs. 5 were permanent supportive housing and 4 were rapid rehousing. Out of a possible 100%, our average score was 65.8%. There was one outlier who did very well in the evaluation and got a 96%. The rest of the projects scored between 48 and 72%. Most of the improvements we saw that are needed in the Housing First evaluation dealt with the service array, the support provided by projects, and connections to community services. That could be things like employment, education, volunteer opportunities, healthcare, and the like. Our next step for this is we have already started and have been for a little while providing technical assistance to help projects improve their outcomes. And we use this information, it supports our collaborative application. HUD asks us to evaluate Housing First annually. And so we do that and we report out in the collaborative application how it's going. For COC performance, we looked at 8 programs. 5 were permanent supportive housing, 3 were rapid rehousing. The average score here was very similar, 65.3. The outlier here was a program that did not perform as well at 25%. The others scored between 64 and 94%. For improvements needed under permanent supportive housing, the biggest improvement was on performance, and performance is related to HUD system performance measures. And then for rapid rehousing, HMIS utilization specifically around timeliness of data entry related to exits. We noticed that some of the projects had people exit, but they didn't put in the exit data within a timely manner after the clients had left the facility. And so that drove the scoring down a little bit. The lead agency is reevaluating the scores to ensure that no system errors cause lower rankings for projects. We are already in the process of working with one of our providers and the HMIS lead agency to make a review of the tool. We'll be setting that review up. If there are errors found in the tool, then we will reevaluate everyone. And if there is a drastic difference in performance, we will do this report again with the more accurate scores. And again, we use this information to support collaborative application and make improvements where needed. So are there any questions about these slides so far? Okay, perfect. Thank you, Eliza. The next slide is one that we did that dealt with unspent funds as of March 31st. The next one of these we will do is as of June 30th, but it is not June 30th yet, so we don't have that available. So this is the information that we provided out to the committees before. We want to talk about it because in the report that follows mine, Colin will do a slight continuation of this information. So what you see before you is the last 3 years of unspent funds. And in the 2021-2022 year, we had about 15% of funds that went unspent. Those funds have expired, so we will move on to 2022 and 2023. There's about 36% of those funds that are unspent. However, there's one organization that represents about close to 60% of those funds. So it is still possible for that organization that is receiving some technical assistance to draw down some funds from that year. So if they do, and if they draw down all of the funds that they were awarded, that would drive that number down to 15%. And then on the 2023 year, this looks alarming, but it's not. Again, this report is as of March, and we will be doing another one soon, but organizations have until the end of this year to draw down and spend these funds. So this is more informational. Again, one organization has yet to draw down any of the funds for this particular year. And so I'll let Colin continue that part of the conversation in his report following this one. All right, so now I'm shifting to the second half of my reports today, which are the funding competitions. So many of you probably already know that on June 11th, the North Carolina Department of Health and Human Services put out the ESG NOFA or request for application. These funds are intended to be used as part of the crisis response system using low barrier housing focused approach to services. You just have to be a nonprofit or a local unit of government to apply. And you have to be serving individuals or families that are at risk of homelessness. However, public housing authorities cannot apply. They're not eligible for these funds. The Durham COC can apply for and intends to apply for $170,260 in this competition. That is the amount we're eligible for. No more than 60% may be used for emergency services, which are street outreach and emergency shelter, and no less than 40% may be used for housing stability, things like rapid rehousing, HMIS, and targeted prevention. So one of the things that will be talked about today is having this group determine that allocation, whether it's 60-40, 50-50, or whatever the group determines. The lead agency received this notification and announced it to the COC on June 17th. We, along with prospective applicants, attended one of three information or technical assistance sessions that were hosted by the state EHG office. And we are sort of ahead of the curve. We already have reviewers that have volunteered to review our applications when we receive them. And those reviewers are coming from our policy and planning committee and our lead agency staff. So thank you to those folks that were willing to serve as reviewers for this competition.
Anthony, there's one question in the chat from Commissioner Carter.
Perfect. Hi, Commissioner Carter.
Is the timing based on the fiscal year?
This is for your previous item, your previous slide, Anthony, I believe.
This is calendar year. If I'm showing the slide that you're talking about, Commissioner Carter, it's calendar year.
Thanks
Okay.
so much. Yeah, makes sense. Thank you.
All right, thank you. I think I got through this whole slide, so let's just go over the timeline. It's here for you to see. It's already been published. A lot of you are organizations that already have it. I'm just gonna call out 3 important dates. So the first would be that we're in the Q&A period, and we will have those answers pushed out through email to the COC by the end of day on Friday. We did receive 3 questions, and so those will be answered in an email to everyone. Also, the last day to submit project applications in the state's smart sheet for projects is July 19th at 5 p.m. All of the folks that received the information also received an updated announcement with a link to the state smart sheet. So anybody who is eligible may go there to apply. We will get those applications by July 19th at 5 p.m. We will go through the review process, and at the August 14th meeting, seek approval from HSAC regarding the funding recommendations for this grant. And then if there's anyone that wants to appeal, there's a short appeals process that will go through August 19th and will be finalized August 27th. And then, I'm sorry, August 22nd. And then we, the lead agency, will submit the regional application via smart sheet by August 26th at 5 p.m. All right. Lastly, I will talk about the COC collaborative application. Unfortunately, we haven't heard a lot from HUD yet about it. The NOFO release is pending usually in early July. We typically around March usually get grant inventory worksheets, but we have not received those, so we don't know a lot yet about the competition. We did receive and review our 2023 scores. We did request on 2 occasions a full debrief from HUD. That is still pending. We have not gotten confirmation as to when we will have that debrief. We have registered for 2024. We anticipate that approximately 2.1 million will be available for new and renewal projects. Applicants, kind of like the ESG process, they both work sort of the same. The projects will apply to the lead agency, which will have the applications reviewed and ranked. And then we make funding recommendations, which go through a process to get to HSAC, and then they're sent to HUD. We will have some review committee and meetings to kick off in July. These are folks that will work collaboratively to put the application together. Keep in mind, you heard me talk about the performance evaluations. That fall COC one will help us to rank applications for the collaborative app. So that will happen again in August for people applying in the collaborative application.
There's one question in the chat about the deadline for ESG. A previous communication stated that the deadline for NC ESG applications was July 16th. So now is the deadline July 19th.
Okay, let me, can you capture who that question is from and let me get back? I may have modified the timeline between the new announcements to try to give more time for folks to apply, but I need to
It
go
was,
back and look at my info to confirm that. So capture who asked it.
it's Ricky Gardner, but I'll know it, so you can send her a
Perfect.
message.
Thank you. All right,
We'll send out a clarifying email to the full COC.
perfect. And then HSAC will approve the final application to be submitted. It is usually due the end of September. Last year, it was the last Friday in September, I believe. Sometimes it can be early October, but we don't have a lot yet to go on. Any other questions for me? This will conclude my presentation for the day.
Thanks, Anthony. I'm not
Thank
seeing
you.
any other hands raised or things in the chat. Oh, never mind. Yes, Commissioner Carter.
Thanks. Anthony, thanks so much for the presentation. I'm just wondering why we're leaving some money on the table with the unexpended funds. That slide it troubles me a little.
I will pass that over to Colin. So some of it precedes my time here, Commissioner Carter, but also you'll hear a little more in his next presentation about it. So
Yeah, so the short answer, Commissioner Carter, is the bulk of that money is tied to leasing. Landlords not willing to work with high barrier households. Fair market rents being higher than they are. Tenants contributing to their rent, where HUD awards that money at assuming you might have to pay 100% of the rent. But when tenants are able to pay, they pay some portion, which sort of leaves a little bit of money that you can't spend. Sometimes it's due to staff turnover. So if you don't have a case manager, you can't pay the case management money for a week or two, which might be a little bit of money here or there while you're in an in-between case managers. You'll shift responsibilities. When you're down a full-time case manager, you'll shift those responsibilities to somebody else who already has a full-time job. So you're not able to bill 100% of that salary to that particular grant. So that leaves a little bit. That's where the bulk of those 15% of allocations kind of come from, those little bits here and there of just trying to get leases lined up correctly and full staffing. There are ways to amend the budget to move it back and forth, and that's something we're providing technical assistance to with our providers to help make sure that they're trying to keep an eye on the numbers and going to HUD early enough to request line item moves. You can move up to 10% only of your grant without having to do a grant amendment. So if you go above a 10% move, it requires a grant amendment, and doing a grant amendment is a time-consuming process from an execution standpoint, from HUD to the subrecipient or to the grantee, and then back to HUD and getting it all lined up. Moving money 10% is a much cleaner and easier thing to do if you can ballpark and move things accordingly. The other piece we'll talk about in the next section.
Great question. Okay, we'll move on to the next section. This is the section we mentioned at the top of the meeting where the full COC will be able to vote. And if I'm counting correctly, that would be three votes within the section. Is that correct, Colin?
I was not counting, I think.
Okay, well,
I'm gonna defer to Keisha.
I'm counting 5.
5 votes. Okay.
Mhm.
So if we want to think about this in sections and not do all the votes at the end, I think that would help people be clear. So I'll hand it over to you, Colin, but whenever it makes sense for us to put a motion on the table or open the floor for a motion, let me know.
All right, we're going to start with So the Code of Federal Regulations that govern everything that we do in the homeless system and everything that we do with federal money is controlled by the Code of Federal Regulations. So one of the things that we have to do is sort of go through the continuum of care, has some administrative duties that are supposed to be done to assign and choose and do things. We have a lot of things that are kind of set up, but we should be renewing and sort of reconfirming that, yes, we want to continue this direction on an annual basis. So at this point, we're going to start with some administrative cleanup just to make sure that we're on the same boat. And yes, we want to continue in this direction for the next year. At this point, it's a little hard to shift because we're in the ESG, in the state ESG application process, and the HUD COC application process has already been registered. So this is our chance to say, if we would like, as a continuum of care, to explore options for next year, that is the time that you could make a motion to explore other pieces. So let me walk through. There's about three decisions that need to sort of be approved. So give me a second, I'm gonna share my screen. So we're going to look at these approvals. So according to the Code of Federal Regulations, the continuum of care needs to designate one agency to be the HMIS lead agency and manage the Homeless Management Information System, HMIS. Currently, that is the North Carolina Coalition to End Homelessness, and they're the ones who manage the HMIS contract with WellSky, who is the current vendor. So we'll need a motion. And if you want to do these one at a time, Eliza, we can do a motion to approve this, or we can batch them all at the end if you'd like.
I would say batch them unless folks have a lot of conversation that makes us think we should not.
Okay. So NCCH is the current HMIS lead agency, and if there is wanting to explore choosing another HMIS lead agency, we could do that. There has at time, it's a very expensive endeavor, as we would need to be able to go through and figure out who's going to manage a contract, who's going to do all the technical assistance, and the cost of doing that. The cost that we pay for NCCH to do this is kind of spread across a lot of folks. So the recommendation would be to keep NCCH as the lead from a cost effectiveness standpoint and continuation. The next is establishing priorities for projects. That's ESG and COC funded. We will take that up in the next presentation that I'm going to do. So we're going to look at choosing a collaborative applicant to collect, combine, and submit the application on behalf of the COC. The Community Development Department in the city of Durham, this homeless team, is currently serving in this role, which is to collect all of this data, write all the, for lack of a better term, write the community application, and then ensure that we have a process to work through the choosing of what projects are going to be recommended for funding in the competition, and then being able to submit that. So once again, this is a chance to say, maybe another group could do that in the future if so chosen. There is some other responsibilities that go with that as well. The third item that we're going to need to do is approve the NOFO application prior to submission. Historically, this has been done by the HSAC, and we have had to move meetings around at the last minute when HUD's timeline doesn't line up with HSAC minutes. So we've had to call emergency meetings. We've had to work ahead of time to schedule it like the month before it's due to get HSAC to approve an email vote. So this is a chance for us to try and get really ahead of the curve and say, okay, this is the plan for approving the final application. So the motions that are being recommended at this point would be to approve NCCH to be the HMIS lead agency for the 24, for the competitions and for the year starting in 24-25. That's this year. Approve the City of Durham Community Development Department to be the collaborative applicant for the HUD COC NOFO, and should be also the state ESG application. Yep, state ESG is in there, so it's hidden behind my thing. And then we need to approve a process to approve the COC NOFO in the event there isn't an HSAC meeting that lines up if and when the COC NOFO is due. The recommendation would be allowing the HSAC or the HSAC Executive Committee to approve the application via email vote if needed. And by the time we get to that, it's been through a lot of ranking and evaluations. And then there's also a window of time to appeal that decision. We just need somebody to be able to approve the final decisions. So those are the administrative pieces that we need to do for this current year. And then if there's anything that people would, if there's a motion and enough people that would like to explore doing something else next year, then we'll need to take that up as a totally separate issue.
Okay, so to be clear, this is for this year. And I just want to make sure before we give people space, if there are questions. Okay, I'm not hearing or seeing any questions. Make sure in the chat. So these are administrative approvals for this year. The process to approve, there's some recommendations here to do one or the other. Is that something that we need to decide on now? As we decide this process, we would say it needs to go to full HSAC or to the executive committee.
If you wanted to get that, historically where it's landed in the past is going to the full HSAC to do an email vote. The advantage to that is you've got more people who lay eyes on it. The disadvantage is you've got more eyes who lay eyes on it, which requires a larger number of people to vote in the affirmative and usually a very short time turnaround. And it's looking at an application that is hundreds of pages long if somebody were to go through and read every little piece of it. So the advantage to the full HSAC making the approval as the governing board of the continuum of care is you've got that, but it's also one of those things that we've got a small window and trying to get enough positive votes in the short term around takes a little bit of time. Executive committee, you're talking 5 people, which is a little more from an efficiency standpoint, easier. There's no right or wrong way to do it. It's just whatever, where does the continuum, where would you prefer to land?
So
And that would only be if the COC, let's say the COC applications due October 1st. Well, we know we'll have a COC meeting September 18th or somewhere around that timeframe. That might line up with enough time for us to get it approved and get the grievances and all the other stuff done before the final approval, but there still may need to be another layer of approval. So this is just sort of putting in if we can't get a meeting like we're having currently in place to approve this, this would be the backup plan.
Right. So just want to open the floor and see if anyone has thoughts around which seems better. It sounds like in the past we have done a full HSAC vote and we have not done this smaller executive committee vote. So there's an option to keep it the same as we have in the past or to make it smaller. Curious if anyone from the executive team has thoughts. I know most likely by the time this happens, I will not be on the executive team. So I want to open the floor for folks in case there are any comments there. And Colin, remind me, this goes to committees as well? Does this go to policy and planning?
The NOFO approval, the NOFO,
Well, just the process.
the process itself goes through similar to what we're doing with the ESG application. Like these kind of all go through a similar process where the application goes out, we have to come up with a local competition, if you will. And then we start with the performance management committee to determine a group of people who are willing to score the applications and rank them one
Right.
through however many. Once that group does their work, it goes back to performance management for kind of, okay, yep, we agree that works. And then it goes to HSAC for approval of ranking and working our way through that process.
Got it. So the shift would be going from HSAC to just executive committee. Renee, I see your hand.
I just wanted to find out about the time frame. Since we have always in the past used the full HSAC vote, I'm just wondering, do you anticipate a need to shorten the time frame, or how will that work? I'm not sure I understand why we would
Sure.
want to do the executive committee.
Great question. The HUD collaborative application historically is announced and released nationwide on or around the July 4th weekend. Without fail, it sort of seems to be, that's about the time frame, either right before or right after the holiday, we get an announcement of that. HUD seems to be a little bit behind because there's things that happen before they release it. There's a grant inventory worksheet that Anthony talked about that is normally released by HUD to the collaborative applicant for us to send back and say, yep, these are all the projects that need to be renewed. That normally happens in the March to April timeframe. It has not been sent out to anybody in the nation yet. So it's sort of making me wonder what the delay is. And HUD historically likes to have all of these applications turned back in by or at the very end of September or very early October. They like to try and get it done before the end of their fiscal year or right at the beginning of a fiscal year. Although there have been times where it's been a lot later, but it's been a long time since it's been like a November, December timeframe where these were due. So we could be back into a November, December timeframe where these are due, at which case we could be looking at these being due right around Thanksgiving or right around Christmas, perhaps, where a lot of folks are gone, and it might not line up with meeting timeframes. So there's no real need to punt it to the executive committee as long as the full HSAC is aware this could happen, and I'm just trying to get us prepared is really what it is. It's trying to say, let's not be making a decision in September on what to do in October. Let's think this through now so that when we're putting together the schedule, we can do the best we can to line everything up to make sure our approvals happen in a live meeting. But sometimes we plan, you all are going to vote and approve the HSAC schedule today. So if HUD's due dates don't line up with this schedule, then we either have to have a plan to deal with their due date, or we as an HSAC have to agree, oops, sorry, we need to move this meeting to a totally different date that's not on anybody's calendars, and hope enough people can shift with less than a month's notice when you've had it on your calendar for 3 months to make approvals. Does that help? I know it's a lot.
Yeah, it does. It does.
A lot of
Yeah.
variables. It's one of the most complicated calculus problems.
Yeah, so I think there's some good questions in the chat, and I'm just thinking about, like, I'm so appreciative of us thinking ahead of time, but I think that it's hard to hear this information and think about this in the same day. So I'm curious. I think where I'm leaning on is, like, we're trying something new and talking about it ahead of time. So let's keep it the same around the HSAC voting. And then this feels like a process item that would be really good to come back to. So that is where I'm leaning in terms of we're shifting one thing, let's not shift two. I'm also thinking about an item that's later on the agenda around needing some positions filled on executive committee. And then a really good point that Sally brings up around people needing to recuse themselves and not being sure of who those people are yet. So that's where I'm leaning toward in terms of that third item is keeping it the same to the full HSAC. And this might be an item that we return to maybe even a little earlier next year. So I think that leaves us with the three together. If there's no other comments or thoughts around putting the three motions on the floor, opening the floor to approving the North Carolina Coalition to End Homelessness to be the Homeless Management Information System lead agency, approving the City of Durham Community Development Department to be the collaborative applicant for the state ESG and HUD COC NOFO, and then approving a process to approve the COC in the event that there isn't an HSAC meeting that lines up to make the vote during our HSAC meeting. We would do an email vote through HSAC, and it would be very important for our HSAC members to please reply as soon as possible to that email vote. So those are the three motions that are on the floor. I'll open the floor.
So do you need a motion to approve or are we just voting?
I believe I
need a
need
motion.
a motion and a second. Yes.
Well, I'll offer the motion to approve.
Thank you, Renee.
I'll second.
I'll second it.
I think, did I hear Shaisha?
Yes.
Okay. Thank you, Evana, too. A second by Shaisha Bell, and then please vote in the chat, yes, no, or abstain. This is a vote. If you are a COC member, you can vote. That's correct, right, Colin? And
That
if
is
you
correct.
are, is there a reason that a COC member would need to recuse themselves?
A COC member would recuse themselves only if they were planning to. Nope, not on this.
Okay.
Nope, sorry.
Thank you. So everyone can vote on this.
Mhm.
Great.
COC
Looks like
members
it's down.
from the same agency would only get one vote per
Oh.
agency.
Okay, do we have
don't-
multiple?
I don't, I'm going through and looking. Nope, I think we're good. At least what I'm seeing in the chat, I don't see anybody that I know of that is voting twice for an agency.
Great. All right, those three motions have passed.
Cool, thank you all. We will move forward with that. Next item is setting the priorities. So give me a second and I will pull up that screen. Okay. All right. So this is just a quick reminder for everyone of the city's role that we just reconfirmed that we are the collaborative applicant. We at the city are only submitting the application to the HUD and the state on behalf of the continuum of care. HUD and the state of North Carolina will enter into contracts directly with any agencies that are selected for these competitions. And the Durham Continuum of Care and the lead agency only monitor the agencies that are selected for performance. We are not evaluating or going on site and monitoring for compliance with all of the full monitoring schedules unless we are asked to do so, or there is a brand new entity who's accepting these funds. We may do a little bit more monitoring of the project, but I don't want to use monitoring in a negative term. It's more of a technical assistance to ensure that there won't be problems if HUD or the state were to come monitor the program. So we as the city are here more in a technical assistance capacity on that, to try and make sure that we head off any issues ahead of time, as we at the city have zero control over these funds. This is a decision for you as the continuum of care to determine how you would like to allocate the state ESG funding. This year, the state has made, as Anthony shared, $170,260 available. 60% of that can be used for street outreach and emergency shelter, so it's a little over 102,000, and no less than 40%, $68,104, can be used for rapid rehousing, HMIS, or targeted prevention. Last year was the first year that we deviated from this 60-40 split. Last year, we used the state ESG money as we recognized we had a growing population of households with children, i.e. families, who were experiencing unsheltered homelessness in Durham. That number was increasing, and there was no money that was specifically prioritized for families experiencing homelessness and unsheltered homelessness. So in 2023's competition, the HSAC approved splitting this. Last year was about $168,000-ish, 50-50. And Policy and Planning Committee is recommending that we do the same thing again this year, that we split the funds, 50% going towards emergency services and 50% going towards housing stability. And the Policy and Planning Committee is also recommending that these funds be prioritized to assist families experiencing homelessness and unsheltered homelessness. So while anybody can apply for these state projects to do any one of these eligible activities, the scoring priority is going to be going towards unsheltered families, or families who are unsheltered, with 50% of the funds going towards stability and 50% of the funds going towards emergency shelter or outreach. So we can take a vote on this if you would like to, or we can go through the rest of the presentation, Madam Chair. Or questions on this particular topic.
I think it'd be good to do questions. Any questions about this recommendation?
We did have a question, and I did look that up, and I got to find my notes where I put it. I believe there were, I want to say it's, hold on a second. Currently, and keep in mind, this contract starts in January of each year. So as of the end of May or early June, when I ran this, there had been 6 families enrolled in the there's six households enrolled in the rapid rehousing component for homeless families with these funds, and 17 households that had been identified and working in street outreach since January. And I believe Housing for New Hope has these contracts, and they may have more accurate data. So I'll have to ask Ricky if she has any information that I'm unable to see from my end in HMIS, but that's what I was able to find.
No, Colin, you were spot on there. Thank you.
Very good. So, so in the first 5 or 6 months of this, and there's usually a ramp up period, so that first month of January isn't a big month of intakes. So it's usually February, March where things start rolling. So in the first 5 months-ish, 4 to 5 months, we're at 6 families enrolled in rapid rehousing and 17 in street outreach.
Shelton, I see your hand.
Great. So I guess I only have a comment, and I know that we see numbers that have increased amongst families. I know we also see increases that we see amongst singles and also other unsheltered folks. As we look at those that, from a food insecurity standpoint, that we serve through the cafe, we probably see anywhere from 50 to 60 additional individuals coming to each meal now than before on a pretty regular basis. And yeah, so all those things have extra cost attached to them as well. But, you know, we will not have any sort of priority for pursuing any funding through this as it's being established.
It would be for families, and the reason this was for families is there was no families and singles were being compared and recommended through the same pipelines of funding at the time, and more singles were being able to score higher and have access to resources. So this was trying to establish a set of funds that would prioritize homeless families, just to be able to say we do have a small cache of money that says the priority would go to serve homeless families, but it doesn't mean exclusive to homeless families. So if you're running a project that serves singles and families, and there are no families that meet your criteria, the expectation would be you would accept singles. And that would be true for any one of these, that this is not an exclusive list. It's sort of at any given point in time. If you've got 10 people in line and 6 of them are families and 4 of them are adults or single adults, you would prioritize the families following the prioritization schedule for providing services to them. And if there's still money and time left, then going to the families. And if it's reversed and there's only 10 single adults, the expectation is the money would get used to meet the needs of those single adults, because at the time there was an opening, there were no eligible families. We would want to use the money, and rather than having it just sit there on the shelf and may not get used before the grant ends. Does that help at all, Sheldon?
I understand, but I don't think it helps.
Okay.
I see another question from Lloyd in the chat. Is the recommendation for emergency services that the funds also be prioritized for homeless families?
That was the recommendation from the Policy and Planning Committee, is using emergency services and stability for families. It doesn't mean it has to stay that way. That was sort of the recommendation, and that's based on the PIT count and the weekly numbers of families staying in the 30s that are unsheltered seeking assistance.
And these 2 recommendations from Policy and Planning are the same as the recommendations that we approved last year. Is that correct?
Correct. Tasha, your question, the expectation is that all of those funds will be completely spent by the end of December. I mean, keep in mind, you're talking about $100,000 and $68,000. If you took it and divided it by 2, you're, hold on, 170 divided by 2. I'm not a good mathematician. Give me a second. Talking about $85,000 for rapid rehousing. And I think the average cost for rapidly rehousing somebody over the course of a year is roughly $5,000. Does that sound about right, rapid rehousing providers? So you might be able to assist up to maybe 17 households during the course of that 12 months with rapid rehousing. And we're almost halfway there already, and we're partway through the year on the rapid rehousing side. And the street outreach is more, there are eligible expenses, but a lot of that is the case management to do the street outreach where that's currently being used. It doesn't mean that it can't be used for other things, running a prevention program with ESG funds is very, very tedious. And so if you haven't done it before, we will want to make sure that if it's applied for and awarded, that it is used very, very wisely, or you will burn through your money in the first 2 months and have nothing left for the rest of the year. And prevention often ends up kicking a can down the road. We're looking at some other places where we've used some of these funds in the past, and folks that received prevention funds probably never would have come into the homeless system. And it became more of a way of not paying rent and getting it used elsewhere. So it's tricky to find where prevention funds are going to make the biggest dent, and we would need to think that through as a system if somebody applies and is awarded those types of funds.
Thank you, Colin.
Mm-hmm. And I'm not saying don't apply for prevention. I'm just saying it's a very nuanced place to be able to figure out how to use it best. And we would have to think through it because it would be, that very small amount of money over 12 months, and it can go very, very quickly.
I guess I was asking, I should have prefaced, compared to the 60-40 split previously, were we able to spend down with that percentage breakdown versus this new percentage breakdown? Do we anticipate being able to spend down? I think that's a factor to consider.
I think I would say yes. I would have to defer to Housing for New Hope. They're the ones who have both of these contracts in this current year. So I don't know if Ricky knows off the top of her head where they are in spending rates or what the anticipated is.
Yeah, can you repeat the question real quick?
Do you all anticipate spending down all of the ESG funds this year?
For rapid rehousing, yes. For street outreach, questionable. Colin alluded to earlier that, if staffing, isn't consistent, it becomes extremely hard to spend down a grant. And that's what we're experiencing on that particular one. So we'll try our best, but cannot guarantee that. We won't fall maybe a little bit short.
And it is possible to have multiple projects awarded out of this. It's not an all or nothing, but it's also one of those things that the size of the grant, it's got to be worth people's time. So getting $10,000, there's probably more headache and admin to manage a $10,000 grant with ESG funds than it is to do $10,000 worth of work. So apply for what you think you need. I don't know what the magic number, what a break-even point would be to make an ESG dollar amount worthwhile. Off the top of my head, that's something that we maybe want to have a conversation about if we have more than one applicant putting in funds, or sort of think through how to be able to make that work.
Thanks for this discussion, everybody. I'd like to move us toward opening the floor for a motion. We have a recommendation from Policy and Planning. So if someone would like to bring that motion forward, or if there's alternative motion that someone would like to make.
This is Heidi. I'd be interested in hearing an answer to Lloyd's questions in the chat.
Hold on, let me find them. Lloyd, hold on a second.
And also Sharita.
So Sheldon will have to answer about serving how it would impact UMD. I think historically, Urban Ministries has only received ESG COVID funds in the past, Sheldon. Is that, I don't know that, so this would be a new funding stream if you applied, is
You-
that?
You're right. We typically have not applied for this particular ESG pot, maybe some years ago,
Mhm.
but definitely not in the last 7 years, probably.
Yeah, not since I've been here that I'm aware of. And then to your question, Lloyd, were all the state ESG funds being used in 2024 allowed to Housing for New Hope? Yes, that's the way all of the funds went to Housing for New Hope in the current year, with 50% for street outreach and 50% for unsheltered families, because that's all that was applied for, that we had eligible applicants for. So last year, thank you, Tasha, families moving forward did not apply for funds last year. They've received funds for shelter operations in the past. So you could apply for, the way this is written is it's really to prioritize families experiencing homelessness and unsheltered homelessness. I don't know that there's going to be a push to focus on street outreach or to do emergency shelter. I think it's going to come down to, application writing and scoring it. And if one scores better than the other, then we have an answer. If they tie, then there might be discussion about, and I'm just hypothesizing, if you have 2 applications coming in, one for unsheltered street outreach and one coming in for emergency shelter for families, and they tie on the scores and they both ask for similar amounts or ask for the whole pot, see if there's a willingness to split the pot if it makes sense economically to do so. I don't know how that would be handled. We'd have to work that through with the scoring committee. But for an Urban Ministries, they could use, if they were to choose to apply for this, potentially could apply to say, all right, we're going to provide, find a way to, under the rules, where would providing food to families fit under which of these types of activities. But there's a lot of organizations that can apply for these funds, any of the providers.
Colin, along those same lines, if Urban Ministries wanted, Urban Ministries, Sheldon just explained that they're seeing increased operating costs related to food and more people seeking food at their cafe.
Mhm.
Urban Ministries serve singles and families, as Lloyd was mentioning.
Mhm.
So if Urban Ministries wanted to apply for funding for emergency shelter with the intent of it going towards food in their cafe, would that count as something that will be serving families, since families are also at Urban Ministries? Would they be eligible for the priority ranking, I guess?
Well, you're going to have to be able to track who's getting served, and using this in a cafe would be doing like a pretty intensive intake.
So it's not appropriate then, is what you're saying?
It's not that it's inappropriate. It might just be administratively more headache than it's worth. It might be better to say, hey, we're an emergency shelter. We want to expand emergency shelter operations and help more families and do food and shelter. And then that might be a better way of doing it than trying to, because these funds don't really lend themselves very easily to a community kitchen or a food bank or a cafe. These funds are really targeted in street outreach and emergency shelter or rapid rehousing. So it's really trying to figure out which of these projects does it fit in, and how to document the beneficiaries, because that's the big piece, is you have to be able to count who got it, what is the race, ethnicity, gender, sexual orientation, a bazillion different data.
Yeah. I think I was actually trying to get back to Lloyd's question about if emergency service funds are priorities for homeless families, what would the impact be on a project like Urban Ministries that serves both single adults and families? And it sounds like there is a way, perhaps, that
absolutely,
Urban they could qualify as and achieve the priority ranking perhaps.
Sure. I mean, there's ways to do all of this. It's just what way do you want to go about applying for the funds and writing a strong application to win? That's what it comes down to. And once we get a strong application, then we can pull it all together and set up the projects and the data and work on that after we get through the process.
Sheldon, I saw your hand go up and then down, so just want to check in.
Yeah, so I just wanted to make it clear. So I think I'm fine. We're fine with the priority set for the families. You know, we do have some needs that we have to meet, but you know, this isn't necessarily the vehicle for some of the reasons that Colin was laying out earlier, potentially to meet that. So I didn't want to sidetrack too much of the discussion about trying to figure out how we might fit into this.
Thanks for that, Sheldon. That's helpful. There's a lot to think about here, and I've heard the presentation twice now, and I'm still even on policy and planning, help bring forward the recommendation. I'm still just trying to think about all the needs and how to maintain some level of flexibility for all of the providers to seek funding they need. So anyway, good to hear that, Sheldon, what you were just explaining.
And like I said, these funds would be prioritized for families. It's not exclusive to families. It's just if there's an eligible family, the family gets in line in front of the single adult. If there's no families, then we expect whoever gets the funds to serve single adults. So you kind of have to be willing to do a little bit of both, which gives you back to your flexibility piece, Heidi, is being able to meet the needs on both sides based on who's there, because we don't want money just sitting in a bank waiting for somebody to come up. It's better to use it and meet a need when the need is there than it is to be squirreling it away and then run into, oh, wait, we're in November. We're not going to spend all the money. And then we're having the conversation. Why didn't the money get spent?
All right. I'm gonna open the floor for a motion. We have one in front of us from policy and planning. This has been a robust discussion. Floor is open. And Colin, this is something we need to move on today, correct?
Yes, because this will be state ESG application will be getting approved by the HSAC in September. And we'll be scoring this in August, so we won't really have another opportunity to look at it because we don't have a July meeting.
I move for approval of the recommendation from policy and planning.
Thanks, Heidi. Do I have a second?
Ebony, I second.
Thank you, Ebony. Again, this is a COC, full COC vote. So please vote in the chat, yes, no, or abstain.
And remember to abstain if you're planning to apply for funds. I apologize, I misspoke. Thank you, Anthony, for sending me a note. State ESG will be submitted in August. So yes, we do need to get this vote done today.
Okay, well, the recommendations from policy and planning have passed.
Sounds good. All right, next item, which is hopefully will be a little quicker, COC funding. Currently, we're dealing with a little about $2.1 million, with $929,000 going to permanent supportive housing, $1 million going to rapid rehousing, $56,000 going to HMIS, and a planning grant that comes to the lead agency to help offset some of the costs of doing the work of $106,000. The COC funding, as a reminder, priority is given to all renewal projects, as we don't want projects to dry up as long as they are performing and meeting the needs, because we don't want to cause disruption for people who are in projects. Funding can be reallocated from underperforming projects or agencies who choose not to continue doing a project. And then those reallocated funds can be used to expand existing projects or create new projects. So wanted to set the stage. The COC funding recommendations, the LGBTQ Center is one of the groups that is voluntarily asking to reallocate roughly $280,000 to $300,000, which is their grant. I don't have the exact dollar figure, for this year's competition. And these funds would be reallocated and prioritized for a permanent supportive housing project, which can be new or an expansion of an existing project. We will want to make sure that we continue working with the LGBTQ Center and the population in Durham who identify as LGBTQ plus, so that we are able to better meet their needs in our homeless system and be respectful and conscious of that from an equal access standpoint. There is a second piece that comes with most of our COC funds, and that is a COC bonus project. HUD typically awards or allows X percentage or X amount of dollars to be used for a bonus project. The recommendation is that any bonus project for COC bonus would be used to expand permanent supportive housing. Once again, it could be a new or existing PSH project. And then HUD has historically allowed people to apply for DV bonus project money, and DV bonus project money would be prioritized for rapid rehousing like it has in the past. So the COC bonus project and the DV bonus money are both being recommended to be used in ways we have prioritized in the past, rather than any changes in that. The reallocation is new. This came up in the last week and a half, that LGBTQ Center had said that they would prefer to allow others to use this fund to meet the needs in the community. So we thank them for all of their hard work and what they've been doing, and also recognize that they're committed to the community at large.
Ricky.
Colin, can you clarify? So there's the reallocation, that's one pot. Then there's a COC bonus
Correct.
of unknown amount.
Correct.
And then there's a DV bonus of unknown amount.
Correct.
Okay.
So the only known that we know that will be awarded is the $300,000 reallocation from the LGBTQ Center. So we do need, that's why we're bringing it to the full COC, is that the full COC is aware of this and can be thinking through, here is $300,000 to do roughly 300,000. It could be 280 to 300. I think I saw their most recent contract was 302,000. And the one previously was 285 maybe. So I don't know what the renewal amount will be, because like I said, this hasn't been a dollar amount that has been shared from HUD on the GIW yet. That's where all these numbers come from. So that roughly 300 pot will be reallocated. So we do need to make sure COC member agencies who are capable would like to apply, and that we get this money applied for. If nobody applies for it, then it gets returned back to HUD. And we lose $300,000 from our system for a year. And then we can try and bring it back. And the reason the policy and planning decided to recommend permanent supportive housing is there seems to be a growing need for permanent supportive housing in the community that can help singles and families, but not prioritized for one over the other. Sharita, I see your question. Were funds by LGBTQ Center used? Yes, money has been spent by the LGBTQ Center. They're in the process of working with HUD to get funds drawn down to be reimbursed for expenses. So that's one of the reasons that there's a lot of money sitting there, is that there's been some hiccups in the access to the accounting, to the online accounting system, that LGBTQ Center is working with HUD and their TA providers to reconcile to be able to make all the draws. So yes, money has been spent.
Ricky, I see your hand.
Colin, does the COC have a preference for either 100% dedicated or dedicated plus, or you'll take either?
We have not set a priority on that. The guidance that we've given over the last few years has been doing dedicated plus, which would allow, and for those who don't know what dedicated plus is, and dedicated means they can only be used for people who meet the full HUD chronic homeless definition. If we set it for dedicated plus, this gives some flexibility where we might have people who have a disabling condition but may not meet the full 12 months of homelessness issue. And if there isn't somebody who meets the chronic homeless definition, we could move to the person who doesn't meet the definition quite yet to get them housed. So it gives you a little bit more flexibility doing a dedicated plus project. At this point, there's no determination that one would be accepted over another. General guidance would be apply for dedicated plus because you still prioritize chronic homelessness in that project as well. And in the event you don't have somebody chronically homeless, you can take somebody who is not chronically homeless. And we're providing a lot of technical assistance to organizations who have been new to using COC funds to do our best to help organizations spend all of their money. So that's the answer to the question you posed in the chat, Sharita.
So these are 3 recommendations, correct, Colin? And we could bunch them together in a motion if someone so wishes. So are there other questions or comments or?
This is Renee. I'll move if you're ready to do that.
I'm ready for a motion if you are.
Yes, so moved.
Great. So we have a motion on the table to accept the HUD COC funding recommendations listed here. Do we have a second? Any additional comments or questions?
This is Jonathan with Durham County Veteran Services. I second the motion.
Thank you, Jonathan. Please vote yes, no, or abstain. This again is a full COC vote. And Colin, if folks are planning to apply, should they abstain again? In this?
Probably best to abstain.
So abstain if you plan to apply. Does abstaining change our total votes needed? No.
Well, no, they're counted in the total of, they're counted in your quorum. You still just need a majority yes. You wouldn't count your abstentions. You would just count yeses versus nos.
I see.
So if you have a majority yeses, Sally, to answer your question, the bonus project, it expands permanent supportive housing in the system. It means that that bonus project can be a new project, or it can expand an existing project. It can be used either way. It's a way to bring more supportive permanent supportive housing into the homeless system in Durham.
All right, I'm seeing majority yeses, so looks like to me that this is passed.
Thank you very much. We will move forward with, and we will keep everybody up to date as we hear more from HUD. There has been some discussion that HUD is being allowed to move to a 2-year grant cycle. So the question is whether or not they'll have a competition this year for 2 years, or if they'll just do an automatic renewal for last year and then do a cycle next year. But we want to be prepared just in the event that we do get something released while everybody's on break in July. We want to be prepared to move forward.
Great. And thank you everybody for staying on with us a bit longer. We have a few more items on our agenda. So we're gonna continue forward to our meeting schedule.
Keisha, do you have that meeting schedule easy to pull up? Just for an approval.
One second, I'm about to share it.
I've got it if you want me to pull it up.
Are you able to see it?
Yes.
Okay.
And to confirm, this is a HSAC vote only, correct?
That is correct. It's the HSAC, it's the HSAC's meetings. COC members are open to join all of the meetings. And you'll see where the proposed full COC meetings are currently on the calendar in December and May.
Great. So anywhere we see dates that have an asterisk, those are dates that don't follow the regular pattern.
That is correct.
And hopefully everybody saw this in the email that came earlier with the agenda and the notes from May. So any questions, edits, concerns from HSAC members? Hearing none, I'll open the floor for a motion to approve the 2024-2025 HSAC meeting schedule.
Abuna, I motion to approve.
Thanks, Abena. Do I have a second?
I second the motion.
Thank you, Manager Page, and please vote in the chat, yes, no, or abstain. This again is just HSAC members. Great, thank you so much. The meeting schedule has been approved. Colin, do you want to give us a quick update about the HUD Youth Homeless System Investment Project update, or is that something that we should move?
It's very short, just to let everybody know that the Central Pines Regional Council applied to HUD on behalf of Durham, Wake, Orange, and Chatham counties to go after a youth grant, which would sort of allow us to collaborate across the jurisdictions to try and enumerate and determine solutions to meeting the homeless youth needs in the region. So it's about $1.6 million that's coming to the region, with groups who have kind of been pulled in as part of this, including Life Skills and LGBTQ Center in Durham, that will be working to try and help us address what's going on in the youth space, meaning 18 to 24-year-olds. So that's all the announcement is. There's nothing else at this point to share, as it's newly announced. I don't think the ink is wet on or dried on the contracts yet, so they'll be working on getting that done. That was something that Lloyd Schmeidler took the lead on helping to coordinate before he retired. So thank you to Lloyd. I know he's on the call today. So thank you, Lloyd, for your last hurrah of helping to coordinate that and working with everybody across the jurisdictions.
It's great news. Thanks, Colin.
Mhm.
All right, I'm gonna keep us moving. So we have another just quick update from me. I will keep it very brief, but essentially during my term as chair, we've had a lot of really good, robust conversation on exec team, and I'm really thankful for our exec team members who bring support, guidance, and feedback and ideas. One of the items that we've discussed a lot in our exec meetings is governance and process. And we seem to just not have enough time to complete our other duties and also discuss that. I think a great example is we brought forward an item in the last meeting around our standing committee ratios, and then sent that back to exec, but we didn't have time in our last meeting to really discuss that fully to bring it back to you all today. So I don't have an update on that, but we hope to in the future. So we have not forgotten. And so kind of in this process of working this year, I think what I've really noticed is opportunity to think about governance and process separate from exec. And so as a part of exec team, we have voted to create a governance ad hoc committee that would report to executive team. As I transition out of chair in August, I'm really looking toward that being the way I continue work with HSAC. So we just wanted to update you all. This is actually a conversation that's happened in the past. It's nothing new. So in 2019, from what I've heard, I was not on HSAC at that time. Former Mayor Schul brought forward a conversation around governance, began those conversations and asked Terry Alabaugh to be a part of that. And then, of course, 2020 happened and our focus shifted elsewhere, as we can all imagine. So kind of bringing some of those conversations back, and currently the ad hoc committee has not met. I am the chair, and I would report to the next HSAC chair and exec committee. alongside a small group of folks. What we're imagining is some short-term tasks, thinking about visual materials and clear communication to help orient folks, things like who can go vote when, how to bring forward items for discussion and presentation as an HSAC member or a COC member, clarity around when HSAC has a role in approving items, recommending funds, and when we don't have a role in that. And also, how do we share information, presentation? So a lot of process pieces. Some of the larger long-term tasks would include things like governance committee governance rewrite and ILA, thinking about compliance and opportunities for potential structure shifts to support functionality and engagement, exploring how other COCs are operating, thinking about potentially how do we make transitions smoother for chairs from year to year, those types of items. So this ad hoc committee will report to exec with some ideas, recommendations. Exec team can offer feedback, and then exec would have to approve it coming toward to HSAC and to COC. So it's just another body where work can happen, because we were finding that in those monthly exec meetings, we really couldn't get to all the items. So hopefully a working meeting to help move some of those conversations forward and bring forward some ideas for exec and for HSAC and COC to take a look at, and also make recommendations and decide what might be some good steps forward. So my plan is to communicate this new ad hoc committee to city and county leadership to update them, just to keep lines of communication open, particularly with our ILA. No matter what change, even if it's very small compliance, we will need to go through both city council and county commission for votes. I'm excited to move into this work to continue supporting. I would be happy to chat with anybody about this. And if you'd like to learn more, please reach out. I'll drop my email in the chat. So that's my quick update. It is very much in the forming stages, but would love to chat with anybody who's interested in participating and learning more. So that's the ad hoc committee update. And I will pass off again to Colin about HSAC leadership opportunities.
Thank you, Eliza. Just a reminder, we will be voting in August. We do have one person who has accepted a nomination for secretary. It does not mean we cannot have more than one person. And we are still looking for vice president. Vice chair. So be on the lookout for us to be reaching out to you all if we don't hear from any of you about coming into the vice chair role. Keep in mind, vice chair assumes the chair role per the interlocal agreement. So vice chair would start in August, and then would become chair in August of 2025. So it's sort of a 2-year commitment there. The only 1-year commitment is secretary, as there isn't an automatic succession plan to move up from secretary. And this is for HSAC members only. So we will be reaching out if we don't hear from others.
And I want to flag too, Colin, we have an opening for performance management chair
Mm-hmm.
as well.
And we're looking for that as well.
Yep. So 2 openings. It's not, well, we can accept more folks that are interested in being secretary, but we're really looking for vice chair as well as a performance management chair.
Yep.
All right, thank you. Please reach out if you're interested, or if you want to ask some questions to learn more. Great. So we've reached the end of our agenda. There's an announcement section with some things that are written, so I'll let y'all take a look at that, and then just want to open the floor if there are other announcements before we adjourn. All right, hearing none. Thank you all for sticking with us some extra time today. you can have July off. And I will open the floor for a motion to adjourn.
7:04. Angela Holmes, I make a motion to adjourn.
Thank you, Angela. Do I have a second?
Abena Bediako, I second.
Thank you, Abena. It is 4:49 and we are adjourned. Thanks, everybody.
Thank you. And I will share, today is Liza's, not Eliza, it's Melissa's last HSAC meeting. She's moving to Washington State. So I did forget to make that announcement. So those who wish can reach out to Melissa between now and July 5th before she leaves us. And we want to thank Melissa for all of her hard work. She's awesome.
Yeah. Melissa is always good at sending me information. Like today, she was helping me understand quorum with COCs and HSAC. So appreciate you so much, Melissa. You will be dearly missed.
Take care, all.
Thanks, everyone. Bye.
Bye.